Hey folks, I'm Sevtap Savas. My pronouns are she, her, and today we are going to talk about healthcare and cancer care considerations for the transgender and gender diverse folks in Newfoundland and Labrador and beyond. We have two very fantastic guests today, Quinn and Sydney. Folks, would you like to introduce yourself briefly? Start with Quinn.
Sure. My name's Quinn Jesso. My pronouns are she, her, and I'm one of the two program coordinators for Trans Support Newfoundland and Labrador.
How about you, Sydney?
My name is Sydney. My pronouns are they, she, and I'm a project facilitator with Trans Support NL. And I'm based out of St. John's.
That's wonderful. Thank you, folks. So let's start with the learning a little bit about Trans Support Newfoundland and Labrador. Like in a couple of minutes, what is this organization about? What are the main activities and objectives? Queen can start and Sydney can follow up.
Sure. Trans Support NL, or just TSNL for short, we aim to do and try to improve the lives of anybody who falls under the two-spirit, trans, gender diverse, intersex, and non-binary populations of Newfoundland and Labrador. And we do this through varying ways, through our programming, through our services. We offer programs such as our Mending Mondays, which is our counseling service that's virtual or in person or over the phone. We also have our peer support groups, which are in St. John's, outside in Corner Brook, Goose Bay, and virtually. Those happen monthly. We have our education services, so offering like workshops or seminars on gender affirming care or, for example, Gender 101, as well as many other things as well. We also have our binder swap, which needs a new name at this point, but it's our gender affirming gear program, which are
Mhm.
we're always trying to expand on as well. And that's open to anybody in Newfoundland and Labrador 16 plus or with a parent or guardian's permission. So we do a lot. And outside of that, and Sydney as well, like we help with system navigation for anybody having trouble navigating the system, which is very hard to do for a lot of people. So we've definitely been doing a lot. I've been with the organization since 2024, and it's been an absolute pleasure working with these people. Sid, I'll pass it on to you.
Mhm. I definitely agree with the pleasure of working with, everybody at TSNL and in the community. Some other things, I definitely have more of a research focus at TSNL. I was brought on to conduct community-based research to help inform our healthcare toolkits, which I'm sure we'll talk a little bit about later.
Yeah.
Some other consultations that we've been involved in locally through the Center, through Memorial University's Faculty of Nursing. We've been asked to consult on research projects at beginning stages with planning and making sure that trans and gender diverse people are adequately and inclusively included in, planning and execution of research, as well as
Perfect.
interpretation of results,
Yeah.
and partnering with other community organizations as well to provide some input on gender inclusivity. So anybody who wants to listen about gender inclusivity, we're here to talk about it.
Pretty
That's
much in a
amazing.
nutshell.
Yeah, that's amazing. So we have really great service and support provided to people with who are, transgender, gender diverse, non-binary, two-spirit, and I think there was one more, intersex, right? Individuals in Newfoundland and Labrador. But you are also very actively involved in the community-based research in Newfoundland and Labrador. The project that you just described with the Faculty of Nursing, right? Involved right before the beginning of the study, like designing, conducting it together and time. That's amazing. That's amazing. I really love it. That's great. So, folks, Canada is the first country, I think, in the world to have census information about the gender, right? So, 2021, I don't think that 2026 is released yet. So
I don't
enough,
think
but
so.
we have a good idea about the number of transgender and gender diverse individuals in Canada and Newfoundland and Labrador, right? So how many people are we talking about?
I believe it's about 100,000 across the
Yeah,
country.
yes,
But some statistics on Newfoundland more specifically, St. John's is the 10th most gender diverse urban center in the country, which is pretty remarkable considering our
yes,
size.
yeah.
Um, as well as we have some of the highest proportions of trans men, trans women, and non-binary people in the country. So a very gender diverse province.
So we are leading something again in this country. So that's amazing. I brought this because 10,000, sorry, 100,000 people are too many thousands of people, right? Even one person is important. And I know I have been reading your report. I would like to show it to everyone. Small changes, big impact. This documentation actually shows that historically transgender, gender diverse individuals existed, um, and they are just becoming more maybe secure to declare their gender and sexual identity. So this kind of government related support, like integrating this kind of collection of this kind of information in the census, is probably helping that this too. So that's amazing. 100,000 people. There are family members, friends, co-workers, neighbors, right?
We
Community
are every
members.
walk of life. Like that's
Yeah,
just simply how it is.
exactly.
And like to build on what you said in regards to like the government side of things, like it was only in 2015 when your gender identity and gender expression were a protected human right in Canada.
Yes.
So it's within the indigenous peoples, like trans two-spirit identities have been there since the beginning of time, but because we didn't have those rights as
Mm,
members of
mm,
society, it's what I think the reason why many didn't come forward and were
yeah,
very secretive about it,
yeah,
because we didn't have a legal leg to stand on as a
yes,
result.
yes, yeah,
So now that it is, and people understand that it's a
yeah,
protected human right in Canada,
yeah,
you're seeing more people comfortable because there are laws in place, hopefully stay in place to protect
yeah,
those of us
yeah,
who are
yeah.
gender diverse.
That's amazing. And this kind of lateness also explains why 2S LGBTQ AI plus community members are one of the underserved communities in the healthcare and cancer care,
For
right?
sure. For sure.
Because we were so late in recognizing this specific group of demographic with unique barriers to healthcare and cancer care. So today we are going to talk about this, and your work, the toolkit that you are going to talk about, and you have talked in the past as well. I know because we met in an event a couple of weeks ago. This is how we ended up coming together today. Um, we are going to talk about these, even though it's late, it's very sad, it's very late, but it's time that healthcare and cancer care becomes gender affirming. What does this mean, gender affirming care? What does it mean to us?
Gender affirming care is primary health care. So, I mean, when it comes to, unfortunately, how a lot of healthcare is looked at when it comes to the trans and gender diverse populations,
Yeah.
for some reason they look at it as different, but it's not. If you had
Mm,
early onset puberty, you were put on hormone blockers. If you had
mm,
an estrogen deficiency, you were given estrogen supplements. If you had a testosterone deficiency, you were given testosterone supplements, which is the exact same thing that they give to trans and gender diverse people who are going through this part of our journeys. So
mm,
there's no difference there. There's no
mm,
special training. I mean, the
mm,
WPATH guidelines have been put in place now for, I don't even know how many years off top of my head, but they've been there long enough that it's a very easy to follow guideline. All the charting, everything you need to know is basically there for you. So saying that, which I've heard from some physicians, that it's not primary health care, to me is laughable. I mean, it is primary health care. And when it
mm,
comes to like cancer and side of things, if we don't go in as like a trans individual, if I go in for, for prostate cancer checks and whatnot, but the healthcare professional, whomever I'm working with, isn't comfortable with being around trans individuals, there's times when I've spoken with people like doctors in the past who have never mentioned having a prostate exam, or they thought it was removed during one of my, trans affirmative surgeries, which again shows the lack of education there.
yeah, yeah,
And first and foremost, I'd like to say I don't look at ignorance as malice. Like just because
mm,
someone doesn't know doesn't
mm,
mean they have any malice in their heart. That just
mm,
means they don't have that bit of education,
yeah,
which is what we try to do with TSNL through our two toolkits. The part that
yeah,
you so graciously just showed, the small changes, big impact, which
yeah,
talks about gender 101, gender
yeah,
identity, gender
yeah,
expression,
yeah,
social and legal
yeah,
transitions. But
Yeah.
part two of that toolkit, which I believe you got the digital copy of there, is all about gender affirming care is primary care. And
Yeah.
it's showing how many doctors out there and nurse practitioners can and have the ability to offer gender affirming care.
Mhm. Mhm.
And we're hoping that if we give them the education, they'll take up
Mhm.
that fight as well.
You know, I'm crossing my fingers. What you have done, what you are doing right now, and what you will be continuing to do is all about, educating us, the healthcare system. And when I see this, it's really great. Like I'm still an ally in training. I'm still trying to learn, different terminologies, etc. But this is in my hand, and I'm going to post the link together with our podcast so that others interested in can also have access to your digital copy. But this is great because this is going to help a lot of barriers while transgender and gender diverse individuals are actually trying to access the healthcare system. And cancer care is a part of healthcare system. So at this moment, I'm not, distinguishing between them, even though we will talk about specifically cancer care later. And one thing that you said, Quinn, really made me remember something. This is actually our third podcast about transgender and cancer care. We had two podcasts with another transgender man with a history of cancer. James Moriarty, amazing, amazing person, right? So we gained some insight about, the experiences of transgender or gender individuals in healthcare and cancer care. He had an amazing gynecological oncologist. So, things seem to be working for him very well right now, but not everybody is lucky. We know that there are barriers expressed by trans LGBTQIA plus community while accessing healthcare. I know another person who said my family doctor is not trans friendly, so when something happens, I go to a walk-in clinic. How unacceptable this is, right? We definitely need. You are so kind.
100% agree.
You are so kind. You say that, if we don't know, it doesn't mean malicious, but to me, if you are a healthcare provider and if you are not providing your service to someone because of their, some characteristics, this is, to me, this is problematic. So you are so kind. I'm not. That's fine. We are going to we are going to, make voices heard here, and diverse of opinions is great. So let's talk about these barriers. I'm sure Sydney, they have research background. Sydney, what do we know in healthcare barriers in Newfoundland and Labrador when it comes to transgender folks and gender diverse folks?
Yeah, one thing I'd like to start the conversation with is something that we typically touch on in our workshop presentations, which I'm sure we'll talk a little bit about at the end, but they are free until March of 2027. Is recognizing, and you mentioned as well, that the 2S LGBTQIA plus community is recognized as late being recognized and as a result underserved, but unfortunately, when we were recognized by, healthcare, specifically mental health related care, there was a lot of pathologization of gender identity and treating it
Mm,
as something that had to be cured.
mm,
Like previous editions of the Diagnostic and Statistical Manual
mhm,
had labeled gender, gender dysphoria and gender diversity as something that had to be treated and,
mhm,
changed to be cisgender again. So we have to
mhm,
treat these underlying issues in order to, make you normal again and fit in with society again. So I believe that a lot of the discrimination and a lot of the negativity that we see surrounding gender related care is a result of this, history of discrimination. But
mhm,
more specifically, in Newfoundland and Labrador, I mean, there's quite a bit of overlap with the existing issues with healthcare, like long wait times,
mhm,
having
mhm,
to leave the province for things like
mhm,
transition-related surgery,
mhm,
difficulty, individuals who have primary care providers and established relationships at that, who are being referred out at really horrible rates. Like I in our survey, we had 81 individuals respond, and 84% of that sample had reported being referred out to an additional provider for
oh,
gender affirming related care. So
mm,
that is horrible for everybody because there are primary care providers who it's not their main job to provide gender affirming care, but because their name is popular in the community and it's well known, all these other providers will refer to this, you know, particular individual or small group of individuals. So, you know, this provider is now overburdened, and
Oh,
the original provider isn't getting any additional education to kind of fill that gap within their own
right.
practice.
Yes.
So we
However,
definitely see a lot of back and forth in that regard.
yeah, I think you are talking about Dr. Sinnott, who is very well known in the Newfoundland and Labrador in trans care and trans healthcare and trans affirming gender affirming care, etc. But you're right. I mean, the primary healthcare providers need to have the education to actually, first of all, to be able to provide a patient provide a relationship with transgender, gender diverse, or other sexual and gender diversity folks. And second, they should be able to, you know, and we will get to that later, but they should be able to, I mean, our primary doctors are the ones that, or healthcare providers is the one that will guide us, refer to us for whether it's cancer screening or healthy behavior, or, you know, so who else can we actually trust when it comes to our health? They are really very critical. So it's very important. And I want to just say that I think I'm a member of Faculty of Medicine. And I do see that there are certain differences and, you know, progress made in the curriculum of undergrad medical school education and also graduate student, because I was in an event, I think it was last November. So we were in a room and then, you know, they ask some you know, questions and ask the a person who's asking the question to introduce themselves. And one of the graduate students said, okay, this my name is this and this, and my pronouns are he, him. Right? I had never heard this before in an educational level. But then everyone else continued like this, right? And I say, you know what, from then on, yes, I'm going to put it on my email signature, and I'm going to introduce myself with my pronouns if possible, at least as an ally. And, you know, this is just one thing that you mentioned in your toolkit. You know, how to, you know, really affirm people, their gender, not to alienate them, not to approach them as someone they are not. So even such a use of words can make such a big difference. And they did make a difference in me, and I'm pretty sure they did in other audience in the event. So Faculty of Medicine is the one that I experience more. I think there are good progress in this area, in that area. So that's great. And I'm looking at the Canadian Cancer Society's website. You know, it's recognized as LGBTQ is one of the underserved communities in cancer care, and they listed a couple of barriers based on what is already known, and they say transphobia and discrimination, as you folks mentioned, limited healthcare provider knowledge about issues affecting trans people, such as gender dysphoria, which again you mentioned, lack of trans-specific resources or education, and concerns about physical and emotional safety from the transgender and gender diverse individuals, because, I mean, historically, you know, as Sydney said, these folks have been discriminated for a very, very long time. And without the legal and governmental support, like Quinn said, it was kind of difficult. So I think we do understand this. So, and everybody needs to understand it. And everybody needs that education to be done. Now, the toolkit about this transgender healthcare, let's talk about this.
Okay.
How was it developed? What are the key recommendations that you can share?
So we were all brought on to TSNL specifically for that toolkit. Sydney from the research perspective, mine more from the community connection piece, because that's where I do the majority of my work, is working within community and community partnerships. And
What's the good of
I
research
think
if you can't get it out to the community?
exactly right. And I think that when it came to the toolkit, we had a team of doctors that were helping us out, that were advisory for us. We had members of the community that were advisory for us, And there was a lot of back and forth, and I mean a
Mm-hmm.
lot of back and forth, because
Mm-hmm.
you put something in and somebody may not like, well, change the wording or this. And I mean,
Yeah.
we want it understandable. So I mean, I think realistically, when you look at our part one toolkit, I like to call it the LE5 method, or do you explain it like I'm five? And that's something that seems to work well with a lot of people. So if you read through that toolkit, as I'm sure you have, it's very easy to understand. So
Yeah.
that was first and
Mhm.
foremost. We didn't want to
Yeah.
create something that you needed a PhD in astrophysics from NASA in order to understand. We wanted you to be able to read it and understand what you read without having to Google every third word.
And you
So
achieved it. You
thank you.
achieved it.
Thank you very much.
Yes.
So, I
Yes.
mean, that was first and foremost. We wanted it to be readily available and understandable.
Yeah.
From there, we looked at what issues were in the system right now. Where did we see gaps, which was around Gender 101, was around creating safe and inclusive spaces. It was around pronoun usage. It was around,
Mhm.
the safe and inclusive policies. It was around looking at transition from multiple factors, because there's multiple factors involved. You've got your internal transition, you've got your social transition, you've got your legal transition,
Legal.
you've got your
Yeah.
medical transition,
Yeah.
and was looking at each of those independently, because a person's journey is their own. Their
Yeah.
destination is their own. You may have multiple trans women, trans men, non-binary individuals, two-spirit individuals. We're on similar paths, but our journeys are our own.
Yeah. Yeah.
And that's something that we really tried to push when we went through the toolkit. And it was, when I say we met a lot, it was what, Sid, 3 times a week, sometimes more, for 2 hours to go through every
Yeah.
little detail
Am-
of that
Amazing.
toolkit to make sure that it was
Yeah.
easily understandable and we were doing justice by the community. We
Yeah.
wanted it to be something from the community for the
Yeah.
community. And
Yeah.
even in part two, where we are not medical professionals,
Yeah.
but we wanted to give something to medical professionals from the
Yes. Yeah.
community so that
Yeah.
they understood us,
Yeah. Yeah.
where
Yeah.
we came from,
Yeah.
and what our journeys can look like and
Yeah.
how they can help those journeys,
Yeah. Yeah.
which is where it comes into where gender affirming care is primary care.
Yeah.
Yeah.
Yeah. And primary care and gender affirming is so important, as we will link it to later to, cancer care as well. So that's amazing. At this point, I want to ask Sydney, did you have anything else to add onto what Quinn says? She did an amazing job explaining things.
Yeah.
But anything?
I think it like came up during, what you said, Quinn, with giving that community perspective. Because of course we know that medical professionals are incredibly competent. Our education is competent, and there are regulatory boards that, ensure that they know exactly what they're doing at all times. However, we do see that gap in trans-related healthcare, and uh, clearly it's not so much a competency thing as much as it is maybe just a misunderstanding or of culture, of trans-related culture, and using how to use appropriate language and whatnot.
Yeah.
So we kind of relied on those existing clinical guidelines,
Mm.
like the World Professional Association for Transgender Healthcare has uh, it has healthcare guidelines that even the MCP program refers to. And Rainbow Health Ontario has done a similar thing, where they have all this information related to transition related care, hormone replacement therapy, all those medicalized things that we don't particularly
Mhm.
have the background in,
Mhm.
as we don't
Mhm.
come from the medical
Mhm.
a medical provider background. So the toolkits were definitely an example of using a little bit of clinical guidelines that are established
Yeah.
already and bringing that
Yeah.
together with the community perspective to try to say, this is what
Yeah.
community needs. Here
Yeah.
is the legitimate resources that exist that you can now apply
Yeah.
to this based on, the issues we see locally. So
That's
hopefully a
amazing.
nudge in the right direction.
And to add to that as well, like, it's also important that, if, as a member of the trans and gender diverse community, if we don't have trust with our medical providers for whatever reason, we're
Yeah.
not going to open up, we're not going to
Yeah.
use those services,
Yeah. Yeah.
and we're going to have gaps in the system. So the
Yeah.
main goal, personally, I feel, from the toolkit is to help establish that trust
Yeah.
between the
Yeah.
Yeah.
trans and gender diverse community and the
Yeah.
medical professionals that
Yeah.
are our primary health care.
Yeah. No, I can certainly see that going through this document a couple of times myself, and I'm sure anybody else who is going to or who has already, reviewed this document can see it. So, uh, what you and maybe other twice LGBT communities are doing is amazing. I'm sorry that this workload has been loaded on your shoulders, but the end result, because I think it's the healthcare system's responsible to provide necessary care to everyone, right? But you are doing amazing advocacy in addition to research and with the legitimate resources, etc., informing the healthcare system. And I think healthcare system has no other way but to integrate all of this into their practice. I'm very positive because things are happening. I know I'm in faculty of medicine over the years, things have been happening. So I'm really positive we have you folks, other organizations, Dr. Sinit and others actually advocating for better healthcare and cancer care. So future is bright. Future, better days ahead.
Here's hoping.
So
Here's hoping.
yeah, absolutely. No. And everything you mentioned in this, forming the trust, safe environments, how transgender and gender diverse individuals would like to be treated in the healthcare system, etc., pretty much translates into cancer care as well, because cancer care is just a part of healthcare system. Very much, the same system works. It's just the focus is different. Cancer care. So let's focus on cancer. Right. So Sydney, I don't know, as a researcher, did you have any idea about, cancer screening rates in transgender individuals or gender diverse individuals, whether there's any differences between cisgender and transgender? Is it something within your knowledge set? If not, that's okay. I have a couple of things to say here.
Yeah, in some of the reading I've done, one of the things that stuck out to me the most and is relevant to what we talked about previously in regard to guidelines and how we apply those guidelines is a lot of, national guidelines related to cancer screening, those types of things, are mostly derived from cisgendered populations and then applied to transgender people.
Mm-hmm.
And of course, like the treat all patients as the same, it almost sounds like it's a good thing where everybody's getting equal treatment, but when you do that and you're applying these guidelines that are created for cisgender people, you're disregarding that diversity, all of those social determinants that are so important for patient outcomes. Like, the minority stress theory is a really big one that comes up for
Yes,
a lot of
yes,
minority communities
yes,
that
yes.
struggle with, financial, social, medical related things. So, what about specifically like the screening? I found an incredible meta-analysis that I can send the citation to from
Okay.
2014. And it looked at 18 studies across across trans and gender diverse people, and they did find that specifically breast and cervical cancers there's quite a bit of difficulty when it comes to people reaching the suggested screening levels, specifically in the trans and gender diverse community. And kind of coming back to those national guidelines and whatnot, I don't have the research on this. I'm not saying that this is a direct cause of that, but there's clearly, again, like this mismatch between how healthcare is being applied and the comfort of trans and gender diverse people coming forward to actually avail of it.
Yeah.
So it could be from a place like gender dysphoria, where somebody has a discomfort with the sex that they were assigned at birth, and as a result, they don't want to undergo those invasive tests. Or it could just come from a place of fear of being discriminated against, not using correct pronouns. So like there are both sides of that coin, where maybe it's how they're interacting, or it's how their anatomy is interacted with. So there's a lot of moving parts there that can kind of be a little bit difficult for trans people to come forward for that type of screening.
Yeah.
I can add to that as well, like in regards to how we're treated. So when I went for top surgery last year, and that was at the Health Sciences in St. John's, I was misgendered almost the entire time I was there for a breast augmentation. I was referred to he, him, and sir the whole time. So if that's the type of treatment that trans and gender diverse people are going to experience, and I have supports in my life, I have the resiliency to get by all of that. It's annoying, it's upsetting, but it's not a barrier for me to go back and do this again if I needed to. But that's not for everybody. And when
Yeah.
we look at those social determinants, as so nicely put, if a person doesn't have supports in their life, or if they don't have the resiliency for whatever reason, and they run into a barrier like that,
Yeah.
they're not going to use those services.
Yeah.
And when you have people who need to go in for their routine screenings, like for, for prostate cancer or cervical cancer or even breast cancer, and we don't, because we know through past experience of how we are going to be discriminated against,
Yeah.
would you want to go to those places?
No.
Yeah. And I've seen some research stating as well that, there are times when trans and gender diverse people, when they finally, when cancer is finally found in them, it's progressed much faster. Well, not
Yeah.
faster. It has progressed
Advanced.
more
Yeah.
if they, it's advanced more as they haven't been, as they weren't doing regular screenings.
Yes.
So,
Yeah.
and of course,
Yeah.
treatment outcomes aren't as great if you can't catch it as soon. So that's,
Yeah.
definitely another negative thing of that, like medical avoidance and not
Yeah.
making those types of considerations.
Yeah, I have a couple of things to add, if I may. So, in terms of misgendering, I am also guilty of that. And recently, I adopted the practice that every time I misgender someone, I am going to make a donation to us LGBT community. I invite everyone to actually think about, because I think I should be able to do more. The reason I'm telling you this is I'm hoping that it will be adopted by others to actually tangibly benefit the community. While also working on their practice to actually use the correct pronouns and gender for the people with the people they are interacting with. And I was also looking at your toolkit, and there are really nice examples of how others can correct misgenderment. For example, you can correct yourself. For example, oh, sorry, sorry, they have an appointment, right? So you can correct yourself. Or someone else can say, actually, this person uses the she, they pronouns, right? We can all help ourselves to actually get this in our minds. And then we can say, thank you for correcting me, right? I will work to get it right. And this is my promise to the community as well. So things may take time, folks, but it's going to happen. And, even this conversation hopefully will help a couple of people to genuinely think about how to do this. Second, Sydney has done an amazing job describing, and Quinn, you as well. When we don't have the trust, when we have the discrimination, when we have misgendered or discriminated at the healthcare system, it's very difficult to get the cancer screening programs as well. Cancer screening programs, for those who are not very familiar with, is offered before the symptoms show. So in other words, you may be perfectly fine, there's nothing wrong with you, but cancer at the initial stages usually do not show any specific symptoms. So cancer screening programs aim to early detect cancers. And if people like trans LGBT community, like indigenous people, and like those people in the rural areas, those people, newcomers with, or socioeconomic barriers, etc., if they are not able to access these programs, and if they are developing cancer, unfortunately, that translates into, cancer in advance. And in advanced stages, cancer is stronger and its treatment is more expensive and more extensive. So nobody gains by detecting it late, but everybody gains, including the governments and healthcare systems and individual and society and workplaces, etc., by detecting cancer early. So Sydney said about the national guidelines, screen guide. There is no national cancer screen guidelines for transgender or gender diverse individuals. I was doing some research. Nova Scotia has some, BC, British Columbia, Quebec, Ontario, of course, right? Manitoba have some guidelines for transgender, gender diverse individuals, and in regards to cancer screening. In Newfoundland and Labrador, I'm not aware of any, but I think it's time that they think about it because we have been advocating for some time. And it will require, as one of the reasons I believe there is no specific guidelines is healthcare system is pretty evidence-based, and evidence means research, They didn't research, they didn't have funding, they didn't provide funding to research. But right now, everybody is interested in underserved communities. There is more funding. Hopefully, more research is coming out, and there will be more. And advocacy is very strong, and hopefully, there will be more guidelines developed, and be at the benefit the people.
I think you're on the money there. Like, I mean, our job, not only as members of the trans and gender diverse community, but as members of the province of Newfoundland and Labrador, is to use our existing privilege to push forward the positive changes that we're trying to see. Not everybody has a voice. Not everybody has the ability to come forward. So working for an organization like TSNL and doing this type of advocacy work, giving a voice to people who can't speak for themselves right now, and just as you're doing as well, like that is what we are all responsible for.
Yeah. So thank you. I think, and it's the right human rights. Everybody should have the same access to same level of, good healthcare and cancer care, regardless of what they are. And second, for underserved communities, we have to speed up the process and even try to compensate what has been not done in the past to help care for them. This is my stand on this. So, anything new before I have a surprise trivia for you? Questions, quiz. Anything else to add on this topic?
I think if I were to add anything to this, I think that as much as the discrimination can be a deterrent for many of us who need to go in for these screenings, for our own health, we're not doing it for the physicians, we're not doing it for anybody, but for our own health, I would rather know than not. I've had members of my family with cancer that, they didn't know until it was almost too late. I don't want to put my partner, my family through that. So as much as it sucks, discrimination is obviously still there. I think it's paramount that for ourselves and for our loved ones, we go and get these screenings, get these tests. And when we do encounter this discrimination, to not just let it slide, to report it, to document it, to bring it to the everybody has a manager, and those managers have managers. Like, keep going up the flagpole, whatever you need to do, because it's not okay.
Absolutely. And I think there is enough support now, right? Legally, government level, healthcare system level supports to actually correct this behavior. So I fully support your proposal. Sydney, did you have something to say?
Yeah, and one of the biggest barriers, from what we've heard from lived experience, what we've heard from research, is the way that language is approached, and how we've kind of spoken about it. We talk about it in our toolkit in regard to having clinical conversations and approaching, instead of using that gendered language like women's health or things like that, using anatomy or organ-based language can be a really great way to make a space more inclusive and get all the answers that you, like a physician, would need, and while respecting an individual's gender identity at the same time. Because, like we were talking about a little earlier, that misunderstanding of some gender affirming surgeries, like still having a prostate, even though that a provider might think you don't. By asking if you have a prostate, then that can just, you get the answer that you need, and you can get screened appropriately, and everything is just done in a much more respectful manner. And it's a very easy way to implement, an easy thing to implement into daily practice.
It really is, because like when you go in for your first time talking to a doctor and you're going through the normal registration process, I've always wondered and argued with medical professionals on this point, is why do we have a set number of questions for the assigned female at birth? Why do we have a set list of questions for assigned male at birth? Why can't we just ask everybody the same questions? If I come in, if you're my doctor, I see you for the first time, ask me, when's the last time I had a pap smear? When's the last time I had a mammogram? When's the last time I had my prostate check? I'm going to tell you yes or no based on my comfort level. But by asking me those types of questions up front, especially when you enter the room and you say, my name is Savas, my pronouns are she, her, how may I
Mhm.
help you today? You automatically come off as an ally.
Mm.
So I'm more inclined to tell you something than somebody who doesn't do that.
Mhm.
But by asking me all of those generic questions, it gives you as a medical professional a better understanding of my current medical requirements and needs
Yeah.
without having to make anybody feel uncomfortable.
Yeah.
Yeah.
Perfect. That's amazing. Amazing. So, yeah, so I was reading a paper because one of the very brilliant med school students and I are actually doing a literature search about HPV self-sampling in transgender and gender diverse individuals, like current processes, cervical or anal or oral examination for, HPV-related pre-lesions and early detect and treat, cancerous tissues or precancerous tissues. So one of the studies mentioned about a trans diverse individual having an encounter with a nurse, and nurse was surprised that the gender on the paper and the person they are seeing in the clinic do not match. Certainly, there's a trans, I think, situation. So she was like, she turned it around. So you have female organs inside, okay? Right, for first, I think it's a transgender man or non-binary individual with a cervix. Okay, so we can do the cervical screening now. So I keep remembering that, right? So you may not have to know it, but focusing on, again, Sydney also mentioned about focusing on the organ or tissue rather than the person itself. May actually, yeah, can make it a little bit. I can understand it as an ally. So yeah, so with this,
It
I'm going
definitely
to.
makes it easier. Like it removes the complication because now you're not making it about gender, you're
Yeah,
making it regarding to the person's body part. Like, okay, you have a penis. We can help you with that. Like
yeah,
it's just complicated as it needs to be,
yeah.
and it makes the person feel more comfortable.
All
And it
right.
benefits everybody as well because, I mean, cisgendered men can get breast cancer and
Mhm.
intersex people, I mean, they
Yeah,
themselves, you
yeah,
don't know what their anatomy is
yeah,
unless you speak to them and ask
yeah,
them. So,
absolutely. Now, so I have a trivia for you, questions. I don't have the answers. So I think that is
Okay.
the main idea of this thing, because we don't have to have answers. Who has the answers? Healthcare system, our primary physicians or others. We are going to go ask them the same question. But if anyone is listening to us, but starting with you, let's see. Um, All right, my question first. Can transgender and gender diverse and non-binary people assigned male at birth be eligible to screen for cervical cancer?
wait,
So
Huh?
if they were assigned, just making sure
Male?
I understand the question. So they
yes,
were assigned male at birth,
Yeah,
and you're wondering, can they get cervical screening?
yes,
But if they don't have a cervix, the
yes,
question can still be asked, but
yes,
the answer I would think no, because I don't have one. As a person who
yes,
was assigned male at birth, I
yeah,
don't have a cervix. But
yeah.
would I be against somebody asking me if I needed that test? Hell no. I would still rather be asked the question.
Okay,
especially
perfect.
now with the anatomy.
Yes, right? So, perfect. How about breast cancer? I think
Yes.
Sydney
Well,
already gave the answer. Some
yeah,
male
like
can get
even
breast cancer.
a cis male or a cis female,
Yeah,
or if you have breast tissue, you can
yeah,
develop breast cancer. So that's open to anybody.
yes.
Yeah.
How
And we
about
had
colon?
report.
Sorry?
We had report from somebody,
Yeah.
they were assigned or they were a cisgender man and had been laughed at by a nurse
Yes.
when they
Yeah.
said that they were here for a breast cancer screening. So
Yeah.
again, it comes, like I said, like I keep saying, it benefits everybody to take a more
Yeah.
inclusive
Absolutely.
approach.
I
Absolutely.
think when it comes to diseases and afflictions of health, people need to realize that the diseases don't target genders,
Yeah. Oh, I
right?
love this. I love this. This is it.
They don't cancer
Yes.
doesn't target gender. Cancer doesn't see a gender. It sees
Yes.
a piece of anatomy that it can infect.
Yeah.
Hard stop.
So
That's it.
I love it. I love it.
The title
So,
of the episode.
sorry, go ahead.
Title of the episode.
Yeah, I mean, so breast, colon screening, prostate screening, lung if you have the organ,
If you
lung,
have the organ, cancer
yes,
doesn't discriminate.
yeah, lung, skin, anal cancer, oral cancer, depends on your even risk profiles. Perfect. So let's turn this around. Can any transgender or gender diverse person assigned female sex at birth be eligible for cervical screening?
See, that could also be a catch-22 question, same as the first one, because most people aren't the check to see if a person is intersex isn't checked very often. So a person may appear and assign female at birth, but may still have a prostate.
Okay. All right. So again,
Right?
it really depends on the
It
presence
depends
of the
on the
organ.
individual. So if you
Yeah.
were going back before people understood, or the medical profession understood what intersex was, you were assigned based on the external genitalia.
Yeah, yeah,
So if
true.
you were assigned male at birth,
Yeah.
but you could still have ovaries, you could still have a womb, you could be
Yes.
assigned female at birth, but still have a prostate or still have testes.
Yeah, yeah.
So so technically, yes, they could be, you could get prostate cancer if you were assigned female at birth, if you are intersex and assigned at birth incorrectly.
Yeah. You are absolutely right. How about people with neovagina? And for those who are not familiar with this term, it's vagina, which is vagina, which is created through as bottom
Penile
surgery.
inversion. Yes.
Yes, right. How about people with neovagina? Do we think that there is a chance there is a screening
Yes,
needed?
because I still go through those screenings. So I've
Mm,
had bottom surgery. I have what the medical field calls a neovagina, which is a vagina crafted out of the penile skin for the procedure
mm,
called a penile inversion.
mhm,
Um, I still go in routinely now that I actually have an OB and a gynecologist that I can speak
mhm,
with, because for the
mhm.
last 5 years, there was none on Western besides my trans-affirmative healthcare physician would do the checks for me. But I still go in to make sure that all the tissue is healthy.
Yeah, all right. And
From a research perspective, I'll
yeah,
also add that I doubt there's any research screening neovaginas for any types of cancer. So maybe there's not even, we don't even have the knowledge yet to ask that kind of question. And maybe, with the increased research, we might see some new developments in that field.
exactly. So Canadian Cancer Society website says that there's some limited evidence that other types of cancer can develop in these tissues because they are driven from some other tissues, but more research is needed. So again, we are
100%.
yes, absolutely, because there was an interest or there it wasn't priority until recently. We didn't have this interest and equity in healthcare or other issues and barriers expressed by the 2S LGBT community. Now is a good time to invest more, do the research and understand this, and so that the people can be very well informed. You folks are amazing. I have one other question.
Sure.
How about those folks with the chest or top surgery, for example, from female to male transition, let's say? Can they develop breast cancer, do you think?
I would still think they can, because all of the breast tissue is not removed. They don't scrape
Yeah,
it down to the bone. So
yeah,
obviously there's still tissue there. And as we've
yeah,
mentioned before,
yeah,
like cis men or people whose gender identity matches the sex they were assigned at birth are still
yeah,
susceptible to breast cancer.
yeah, yeah,
So if you have breast tissue, and as
yeah.
we've already said, cancer doesn't discriminate,
No,
then yes, I'm
yeah.
100% think you can.
You are so right again. So 2 years ago, we had actually a public event about transgender individuals and cancer in this province, and we invited two transgender and gender diverse people from United States who had a documentary about their cancer journey. And one of them had a top surgery and but developed breast. Again, the same thing, if I remember correctly, because at that time, some of the oncologists in the room were very surprised as well, right? So we didn't know that. We didn't know that. We thought the top surgery, right? So yes, top surgery doesn't seem to be removing all breast tissue, so there may be residual tissue and the risk. I think my job is done. I think you folks know more answers than I do, but we still have to rely on and ask for more research, more investment, and more better and comprehensive screening guidelines from our healthcare system and cancer care programs and the governments. Amazing.
Our
We
conversation
need
shows the
community
importance of.
collaboration.
Yeah, collaboration. Sorry. Yes, absolutely. And sorry, Sydney, go ahead.
Yeah, pretty much I was going to say the same thing. This conversation, I think, really highlights how important it is to bring both of those perspectives together, that we can both learn a lot from each other.
Yeah. So I'm bringing research and LI perspectives. Obviously, I don't know much, but you know a lot from the community, and some of the answers you provided, like I didn't even know that. That's amazing. And next time, I'm hoping that we can actually have an oncologist, maybe someone from the Princess Margaret Hospital is an amazing sexual and gender diverse group in cancer care. And I actually know a couple of those folks. I met with them as part of a community of practice. Actually, we have a community of practice meeting on Friday. And I also met with them during a conference. So I don't know, I want to somehow connect with them and ask them, is like, how does it work in Princess Margaret Hospital, the cancer care for the sex and gender diverse folks? Because I think there are a lot of things that we can learn from others and we can press here as well and have this conversation from social work and a physician point of view, community and researchers like me can also, chip in. So how about that? Let's do it.
I think it'd be 100% the best way to go. The biggest problem I find when it comes to organizations, regardless of its healthcare or others, is we're all siloed. Everybody is functioning in their own little box and they don't see the forest through the trees. Like if we don't begin to collaborate, have community involvement, healthcare professionals, municipality, government, if we don't all soon start collaborating, we're going to have a lot more problems than we have now.
No, absolutely. Collaboration is amazing. I think final messages will be exactly this. Collaboration. We have to work together, and everybody wins when we are healthy. Everybody.
100%.
Everybody wins when any of us is healthy and everyone is healthy. So I think even somebody may not be particularly interested in to LGBTQ or others demographic groups' health, but even then, hopefully they will think that okay, there is actually benefit to everyone. Because people have different perspectives on everything. But I think nobody wins if we don't provide a good care to everyone. So, but it's going to happen. A little bit slow, but it's happening.
We are definitely moving in the right direction. I mean, it took almost 100 years for women to be allowed to wear pants in Newfoundland. So, I mean, we're moving in the right direction, that people's rights are starting to be looked at more seriously. What is, a person's pronoun, a person's gender expression, and how they're treated not only in society, but through medical professionals as well. And at the end of the day, medical professionals are going to start looking at their bottom line. If you don't have clients, you're not making bank. So if you don't want to you don't want clients, you don't want money, that's fine, but we'll go elsewhere.
Good. I like your approach to problem solving, Quinn. You are wonderful, and
it's direct and to the point. It's just the easiest way to get there.
Amazing. All right, we have been chatting for almost an hour. I think we can continue, but let's do it another time if that's okay with you. We can continue with the additional, I think, guests, if that's okay with you, because I think we really need to learn more about cancer care for gender diverse individuals. How does it work in other provinces, and how we can maybe adapt it here. Any final words, Sydney, Quinn?
Our workshop we tailor it specifically to the audiences who reach out to us. So we have spoken to therapists, community health workers, medical care providers, whatever your organization or personal or team needs are. We offer free workshops on how to improve gender affirming care in your workplace until March of 2027. And we can send the link along for that as well. That will bring you to the toolkit as well as the sign up page.
Oh, that's amazing. Yes, and I'm going to, advise it to some of my colleagues as well as my team. So let's do it. Thank you so much for this. How about you, Quinn? Any final words before we close up today?
I just think that at the end of the day, we are all stardust on this blue marble going through space. We need to get along. We need to talk to one another. We need to collaborate with one
Mhm.
another.
Mhm.
Research without the work isn't going to happen. The work
Yeah,
without the research isn't
yeah,
going to happen. We
yeah,
need to come together as a community in order to make the changes that we need to see in
yeah,
this world.
yeah, yeah. I agree. Very wise words. Very wise words. Well, folks, thank you so much. I learned, and I also have a lot of joyful moments in terms of learning new stuff, and and having some more hope for our future. And I know it's going to be so much better tomorrow. So thanks again, and I'll see you next time. Thank you very much.